So what do you do at 5 a.m. in the morning? So the obvious answer is probably sleeping, but for me, I'm a man that likes to take on challenges, and so I'm up at 5 working on my craft. And so about 2 years ago, I decided to take on a spontaneous challenge where I was going to learn on how to do a handstand. But what I quickly learned that this was going to be a journey. And so within that journey, I learned 2 important values: self-discipline and focus. In terms of self-discipline, I really had to learn how to stay committed and motivated on days I only made 1% improvement on my handstand. Additionally, I had to learn how to stay focused on my mind-muscle connection to understand what part of my body was causing imbalance and then strategize to address that balance. And so fast forward today, I'm happy to say that I can hold a handstand for about 25 to 30 seconds. And so I tell you this story because I believe it gives good context of how I tackle challenges both personally and professionally. For example, about 2.5 years ago, I took on a position at the Alzheimer's Disease and Memory Disorder Center at Rhode Island Hospital, where as outreach coordinator, where I had 2 objectives: to do primary care doctor outreach and to increase our minority enrollment in our research program. And so the challenge here is that on one hand, you'd be lucky to get 5 minutes on the phone with a primary care doctor. And on the other hand, about over 90% of all Alzheimer's disease clinical trials are done on white research patients. And so as my first job out of college, I was motivated on taking on this bold initiative. And so it was both through self-discipline and focus that I had to learn to balance both the world of research and community into a cohesive agenda. And so within that journey, I gained 2 new skills. First, adaptive communication, where I had to learn how to talk about Alzheimer's disease from medical professionals to general public. And so throughout this process, I learned how to strategize with primary care doctors and how to network within the Rhode Island community. And so such efforts led to a high point at my tenure at Rhode Island Hospital, where I helped lead a pilot project. We teamed up with a primary care doctor's office, and we used their EMR system to identify at-risk patients to enroll in our Alzheimer's disease prevention registry. About 23% of the research participants that we recruited came from a racial minority group. And so in terms of impact, we believe that projects such as this could give you insight on how to recruit for future Alzheimer's research, but also how to engage communities that are often underrepresented and underserved. And so that's when I became interested at the intersection of data, technology, healthcare, but most importantly, people. And so that brings me to my current challenge, where I'm pivoting from my public health research background into the data science field. And so for the next 2 years, I am focused on forging my experience to a career to what I call a data science ambassador. And so very much like a handstand, a data science ambassador is a balancing act of the most important skills that you can have in today's workforce. So it starts out with my training on CDC and NIH-funded research project, where it's really molded my critical thinking skills to understand complex healthcare issues that we face today. And lastly, this is layered with my data science training here at the University of Michigan that includes Python, SQL, machine learning, and database management. If your organization is in need of a data science ambassador, look no further. My name is Josué Molina. I'm a first-year Master's Health Informatics student, where we talk all things data, technology, and healthcare.